Hello, this is Dr. Robert Hennessy. I'm an occupational medicine physician right now in Riverside, California. My background is in family practice. I'm a board certified family practitioner. I've worked in hospital medicine as a hospitalist. Also, I was a nursing home director, and I've worked with hospice patients, also general family practice, outpatient medicine, also urgent care. I have got a reasonable amount of experience taking care of people and seeing what's going on. The reason I'm making this video, and it's March 22nd, 2020 that I'm doing this, is because I was explaining some of the realities of this COVID situation to one of the patients at my clinic, and he said, you really ought to make a video and put it online so that more people could see this. And so that's what I'm doing. Because the long and short of it is that our response to this COVID virus has been way exaggerated and excessive. And it really looks like the cure is worse than the disease, a lot worse than the disease. So I wanted to kind of try to put that in perspective. I'm not trying to say there's some kind of evil intent or bad or ill will on the part of our leaders and what they're doing to us here, because really they're being motivated by fear, and it's the usual way that a lot of things are done in our life right now. So it's not really an out of bounds type of response, but it's still not a good one, not one that I agree with. Because I'm aware that in medicine, there's a lot of things we do based on questionable benefit. I mean, we implemented a mandatory varicella vaccination program without any evidence at all of what exactly it would do. And I mean, I'm not normally a conspiracy theorist as far as like power of drug companies and everything, but I had to question that. I mean, sometimes things get rushed through for our own good, and you do have to kind of wonder as to why. At any rate, I'm not saying there's any ill will on anyone's part here. And I think that many of the medical quote unquote experts, they're saying, well, because they're being asked, well, how could we reduce this? And they're saying, well, you could do these things. But nobody's saying, well, what's the result of doing those things? Because we're always supposed to be doing a cost-benefit analysis. That's like emissions on a car. We can eliminate 99.5% of the emissions for, say, $150, and we could eliminate the other 0.4 more for $4,000 more. So would we do that? Would that really be worth it to do? But our leaders right now are doing that kind of thing. So what I did is I gathered some numbers to try to make it a little bit more understandable what we're actually talking about here. So first of all, China. So we know this virus came from China. We don't know exactly how, and it's not important. I mean, this could have been a purely natural mutation from a pre-existing coronavirus very easily. I mean, we don't need to have conspiracy theories about where it came from. But we do know there's approximately 1.386 billion people in China, and we know that they've had approximately 82,000 cases and 3,300 deaths. So what that rounds out to is that approximately 1 in every 17,000 in China got infected with the coronavirus, and about 1 in 425,000 died. Which, I mean, I'm not sitting here saying, well, life is expendable. No, any preventable death is a good death to prevent, but you also have to ask, it's a complex calculation, because you could be doing things that ultimately are going to cause more deaths by what you do. So you have to be careful about that. All right. And so we also know Italy has been hit hard. They have a much higher death rate, 10%. We don't really know why. Most countries really do have a 2 to 3% death rate of those infected, and we know pretty much the people are over 60. That's my age group. But not just over 60, sick people over 60. Mostly people living in nursing homes, skilled outpatient residential facilities, assisted living, people whose health really isn't that good. 60 and not too good health. Okay? those are the people, and probably maybe some younger people in a lot worse health than normal. Because unfortunately, yeah, there's people like that out there, and all those people are important. Okay, so we're going to come around to what my recommendation is going to be, how to protect those people, and it's different from this one. So in the United States, we have about 72 and 73 million people over the age of 60. All right, we know that. So this is a number I bet nobody's heard. So how many of them die anyway without COVID virus between 60 and 85, or between 60 and over 85? How many of those people are dying every year? So I looked this stuff up. These are public statistics. It turns out that between over the age of 60, approximately 710,000 of those people are dying every year. That's 1945 a day. That's a lot of people dying every day in that age group without coronavirus at all. And we also are being told that statistically approximately 20,000 people in the U.S. are dying of viral pneumonia every year. Not COVID-19, adenovirus, RSV virus, parainfluenza, influenza. We already know that, but we're not shutting down the country because of it. Why is that? And I'm not trying to say this COVID isn't a pretty aggressive virus. It appears to be pretty resilient, and a little bit more infectious and a little bit more virulent. It's not a good virus. No, we don't want to get it. It's not a common cold for the people at risk. So no, we don't want to get it. It's more akin to a bit higher level of flu than normal. So the other thing is, who's getting it? There does look like there's some evidence of genetic susceptibility. The one small study showing the type A blood, that's probably a surrogate for some other genetic condition or genetic makeup. And that could possibly explain what's going on in Italy. When you look at it, Germany, with its right above there, they're not having that. And and Spain is a little in between. I also saw a case, much publicized, of a U.S. case, a U.S. family where a lot of the people were affected. It's like, oh my gosh, this virus must be just devastatingly, just going through the population. It's like, well, maybe there's another explanation. Maybe there's something in that family's genetics that's causing them to be more susceptible. That's a little bit more scientifically likely. Okay, all right. There's other things about this what they're doing. Okay, so if you look at it originally when it came about, the UK, they did some scientific calculations. They looked at it. Essentially, they said no need to be locking anything down, restricting people's gatherings. Just heighten your usual precautions. And you know what? That was right. But what happened is this fear. Nobody wants to be blamed for a death, because that's really that's a symptom that's of what's something else that's wrong in our society already right now, is trying to use something against your opponents. Whether it's true or not makes no difference. Just accuse them. And so obviously that would have motivated Trump and these governors and stuff. They don't want to be accused of not protecting their people, because there's going to be people, let's say that they did what really needed to be done, which is just reinforce personal hygiene, wash your hands before you touch your face. See, I wash my hands. So wash your hands before you touch your face. Certainly when you come in from outside, wash your hands. First thing, wash your hands. These are things I've always done. Because this isn't the only virus in town. There's other viruses and bacteria all over the place wherever you go. So it was always a good idea. If they wanted to enhance the precautions, they could. Some airports have already done this. There's airports where you don't have to touch anything to go to the bathroom. You go in there, it's all automated. There's no door handles to touch. There's no toilets to touch. There's no handles to touch. That's pretty good, that's pretty good. So workplaces could try to move towards that model, fewer door handles to touch, and then they could have had enhanced cleaning. And of course, focus particularly on where? The risk people. Nursing homes, hospitals, aged care facilities, residential homes, people that are at heightened risk. Those precautions could have been stepped up. They could have been heightened. The vigilance for the disinfecting procedures, which probably really are already in place in those places, could have been stepped up. There could have been additional precautions to isolate and restrict people who have an active cough. I mean, yeah, could have said there could have been a thing about not to go out in public with an active cough, because people aren't going to cough into their sleeve. I mean, you may or maybe have the option to wear a mask if you have a cough in public, which that was part of the original recommendations. That's not unreasonable. That's not stopping life to do that. They could have done that. But what's happened that's wrong is locking everyone down. They crossed the line when they started saying we're going to restrict gatherings. No, there was never a reason to restrict gatherings. And then they started getting off into, fear. Like, oh, well, this virus could be in the air somewhere. We know it stays in the air for 3 hours. Okay, yeah, that's true. That's true. So how come you're not shutting Walmart down? There's a lot of people in Walmart trying to buy food, which of course they can't get because of the fear. But I mean, look, that's just irrational. You can't shut life down. Yes, some people are going to get so let's say somebody has a coronavirus and they coughed at Walmart, and you happen to walk into an area where the virus was still in the air and you got it. Let's say you were at risk and you got significantly sick. Yeah, you'd go to the hospital. Maybe you got put on a ventilator. Okay, that's the other thing. It's like, okay, I saw one doctor on TV actually say this, which is to me incredible. He's an expert, he's an expert. So I asked him, well, how many extra ventilators do you think we might need? And he's like, oh, it'd be over 100,000 might be needed. It's like, really? We're a country 1/4 the size of China. Their total death rate's 3,300, and we're going to need hundreds of thousands of extra respirators here, ventilators. Really? That's an insane statement. But you've got nobody there saying, even questioning it, like, oh, well, where did you get that number? And the other thing is okay, so then there's the fear. I know what these people are fearing. They're like, oh, what if we have a run on? What if we have a problem with not enough ventilators at the hospital? What if it does put a stress on our system? Okay, that's a real public health fear. So, but what's the response to it? What's the rational response to it? Is it to shut the world down? Is that how you do it? I mean, it's hard to find an example of it. I mean, of what that's like, that kind of thinking. It's like there might be a car accident on this freeway today, so no one can get on that freeway. I mean, that's the kind of thinking. How about coming up with a rational plan? Okay, hospitals could have contingency plans to increase their ICU level care beds. Have that in place. Then you could have contingency plans. Let's say there was a particular area of the country that looks like New York City is getting it a little bit more than usual now. Let's just say we're starting to stretch the capacity. Yeah, but there's a lot of other smaller cities and other places that you can take people that aren't going to be in that position. We do that now. You come into a hospital, it's not the level of trauma care you need, we life flight you somewhere that does. I mean, that's not new. We have ways to do that. There's rational ways to do that we've been doing this whole time to take care of people who need certain levels of care that aren't available at a certain place. All right, I mean, this idea that this was just going to explode into a massive, deadly thing where people are going to be dropping like flies, bodies in the street. That's the kind of picture that they're trying to paint, and no, that's not going to happen. That's not happening. That's irrational. And they like to do that though because, yeah, I'm not saying they really like shutting life down. And I think maybe if they really understood and knew better, they wouldn't. But these are the people who tell kids that, they're going to be safe riding a bike wearing a helmet. Which, when I was a kid, no, we had a different way to do it. It was on us as kids. You could not allow yourself to be hit by a car. You could not put yourself in any kind of position. You couldn't ride a bike anywhere where a car might hit you. That was the only way to guarantee that it wouldn't happen. It was on you. You weren't putting it on the car to avoid you. And certainly, putting a helmet on, yeah. I wonder if anybody's ever calculated exactly how many deaths have been avoided or what the statistics are since they started doing that. Have we really prevented any deaths? Because I'm concerned that kids have a false sense of safety by wearing that helmet. And they think, they don't look and see, they're not, I got a helmet on. Well, you'll be dead with your helmet on if a truck hits you. At any rate, these are the kinds of decision making that we have now. That it's just, we'll make everybody do this. But is that really the best way to do things? And obviously, I don't think so. I got that strange remnant of American spirit of freedom and individual responsibility. Yeah, I think we need to take another look at that. What about individuals making their own decisions about what's good for them? Maybe there should be. Obviously, in extreme situations, the government's going to have to step in. World War II, they had to, the food rationing or whatever they had to do. Obviously, there's times when the government's going to have to step in. If this really was a deadly virus, let's say this was really a deadly virus that you were likely to get, and if you did get it, it was likely to kill you. So something like an Ebola virus. Okay, like a super contagious Ebola virus. That's one other thing I was going to point out. Okay, right now, this was as of a couple of days ago in the U.S. These are the numbers that we're talking about here. 330 million people in the general population. So approximately, I guess it's 30,000 cases. So one in about 14,000 people would get it in the general population. And the deaths, I guess they've gotten up to 300, which, was, I'm sorry. So yes. So the number of cases was more like one in 1.642, one in about 750,000 people, and then the deaths were one in about 5,000, something like that. It's just not that high. There were places where, yeah, that was like, like the death rate over 60, 1 in 415 people who got infected. Excuse me, 1 in 415 people over 60. Because the death rate's higher there. But the point is that there was ways to. There's not a massive outbreak of this disease. Like the number of cases, in the general population, 1 in 20 and 15,219, something like that. I don't know if I have the right numbers here. I scribbled this down pretty fast. But there's not that many people. 330 million people with whatever it was, 3,000 cases, it's just not that high. And okay, so this is the thing. If you look at the at-risk population, that's what's important. Okay, so let's say you had 50 deaths a day. For 6 weeks, that's 2,100 people. But there's already 1945 a day dying of other things. So you'd be changing that from 1945 to 2005. It's just not it's not that many, and you could focus your efforts at preventing those things. That's like saying, yeah, so we're driving his car down the road, and we notice the road is curving. So we've got to instead of just stopping the car, turning the wheel, we're going to jump out and frantically try to build a road straight ahead so we don't have to turn. I mean, that's not the way to do it. No, or you're coming up to this huge wall, or you're driving into a mountain, and instead of deciding to put on the brakes to try to stop you from hitting the mountain, no, instead you jump out and try to tear the mountain down so you don't have to put on the brakes. That makes no sense. At any rate, that's really what I'm trying to say, is that, these ideas that, it just could be out in the air somewhere and anybody could get, in fact, it's just not true. There's no evidence for that. It doesn't justify shutting down life. And that was one other point I wanted to make, especially for all the non-essential people. That's an interesting concept. I think that kind of also shows the arrogance of the elites. I mean, who are they to be telling people, what you do is non-essential? Well, it's essential to them. They can't live without. We'll give you $1,000. How many people how long are you going to live on $1,000? Please. People have car payments, house payments, rent. I mean, it's insane. You're non-essential. What you do is non-essential. No, everything is essential in a society that's interdependent. Each person, each function is interdependent on everyone else. There's no non-essential people here. That's the other thing that I wanted to say. Everyone and everyone's essential. And that's a totally false idea. And it's despicable. That's it for now. Okay, we'll see how this pans out, but I'll bet I was right. That's the other thing is, when it comes down to oops, turns out not that many people got sick and died of this. Then they'll say, it's because of what we did. It's because of what we did. But it's not. No, they could have accomplished the very same thing and not done any of the nonsense. Okay, bye for now.